Hey everybody, it's Chad again with Frontline Legal Services, and I'm coming to you with part 2 of HIV 101 education. So last time we talked about what HIV stands for, the negative effects it has on the body, as well as a little bit of history around or about HIV. And so today we will be talking about HIV transmission, ways HIV is transmitted, ways HIV is not transmitted, as well as symptoms and stages of HIV and HIV testing. So let's hop right into it. So how is HIV transmitted? HIV is transmitted through, number 1, vaginal or anal sex that's unprotected. It can also be transmitted from a mother or her baby during pregnancy, birth, or breastfeeding. However, this is less common now due to today's modern medicine advancements in the treatment of HIV. Sharing of needles, syringes, and other injection equipment is another way HIV is transmitted. This is because if you are sharing used needles, there may be blood on it, and that blood may have HIV or may carry HIV, excuse me. Yes. And however, although rare, oral sex is another way that it could be transmitted. And this is because ejaculation in the mouth with oral ulcers, bleeding gums, or if someone has genital sores. Ways HIV is not transmitted. There are a lot of misconceptions about some of these things. However, you cannot get HIV by any of these following things. So air or water. Someone cannot breathe on you and you catch HIV or contract HIV. Saliva. Someone cannot spit on you and you contract HIV. Sweat, tears, or closed mouth kissing, insects or pets, sharing of toilets, food, or drinks. So again, HIV cannot be transmitted by any of these following: air or water, saliva, sweat, tears, or closed mouth kissing, insects or pets, sharing of toilets, food, or drinks. So, moving on to stages of HIV, there are 3 different stages of HIV. The first stage is acute HIV infection. So during this stage, people have a large amount of HIV in their blood and are very contagious. Some people have flu-like symptoms. This is the body's natural response to infection. This also is seroconversion, or when the body is developing detectable levels of HIV in the body. A good thing to note is that if a person takes an HIV test before seroconversion begins, it will likely be negative. Something worth noting is that people may not feel sick right away, and some may not experience any symptoms at all. All reasons why getting tested is important. So, stage 2 is chronic HIV infection. This stage is also called the asymptomatic HIV infection or clinical latency, meaning that the body is not producing any symptoms. HIV is still active in the body, but is reproducing at low levels. And without taking medicine, this period can last a decade or longer. People can still transmit HIV in this phase. And then at the end of this phase, the amount of HIV in the blood, also known as viral load, goes up and CD4 cell count goes down. The person may have symptoms as the virus level increases in the body, and the person moves into stage 3, which is acquired immunodeficiency syndrome, or stage 3 HIV. And actually, I believe people are trying to get out of, or they're trying to move into saying stage 3 HIV more than, rather than saying AIDS, due to the fact that there's so much stigma behind the word AIDS, or the term AIDS. So, during stage 3 HIV, this is the most severe phase of HIV infection. People with AIDS, such as have such badly damaged immune systems that they get an increasingly number of severe illnesses, also known as opportunistic infections. People receive an AIDS or stage 3 HIV diagnosis when their CD4 count drops below 200. Without treatment, people with stage 3 HIV typically survive 3 years. So, what are some symptoms? Honestly, some people may not show any symptoms. It just depends. It goes on a person by person basis. But there are some symptoms that come with contracting HIV sometimes. But the only way to know for sure if a person has HIV is to just get tested. Some symptoms include will come within the first few days and last several weeks, and these symptoms happen during the acute HIV phase. So you have some symptoms are fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. So again, the only way to know is to get tested. And according to the CDC, it is recommended that everyone between the ages of 13 through 64 get tested for HIV at least once. People that are at higher risk, of course, need to get tested more often. What constitutes a person who is at higher risk? Well, if you answer yes to any of these questions, it would be beneficial to get tested at least once a year. Sexually active gay, bisexual men, or men who have sex with men would benefit from being tested every 3 to 6 months. So what are the questions? Here we go. Are you a man who has had sex with another man? Have you had vaginal or anal sex with a partner who has HIV? Have you had more than one sex partner since your last HIV test? Have you injected drugs and shared needles, syringes, or other drug injection equipment such as cookers with others? Have you exchanged sex for drugs or money? Have you been diagnosed with or treated with another STI or STD? Have you been diagnosed or treated with hepatitis or tuberculosis? Have you had sex with someone who can answer yes to any of these previous questions? So what are the benefits of getting tested? Basically, the knowledge of knowing and the power. When you have the knowledge, you have the power to do something about it. And there's so many resources and so many treatment options out there. So if you test positive, treatment is available to suppress the virus, restore your immune system, and prevent you from spreading HIV to someone else. If you are negative, now you know you're negative, and perhaps you can take advantage of some of the medical benefits to keep yourself from getting it, such as PrEP, what have you. So in the next video, that's what we'll be going more in depth about. So treatment options, treatment as prevention, emergency treatment, as well as treatment if you somehow contract HIV. So stay tuned.